Today we're diving deep into the difference between LED and laser therapy. Basically, both LED and laser use light to improve your skin, but they're doing completely different jobs using completely different mechanisms. Think of it this way: LED is like going to the gym every day and building strength over time. And laser is kind of like getting surgery to fix a specific problem. Starting with LED or photobiomodulation works through something that happens deep in your mitochondria. So these are power plants that sit in every single cell of your skin. Inside these mitochondria, there's an enzyme called cytochrome C oxidase. When photons from LED light are absorbed by cytochrome C oxidase, they literally change how your mitochondria produce energy. The enzyme shifts into a more active state. The electron transport chain gets supercharged and boom, your cells start cranking out more ATP, energy currency that your cells run on. But it gets better. The process also releases nitric oxide that's been binding cytochrome C oxidase to inhibiting it. So you're not just adding energy, you're removing the brakes, basically. And the result, your fibroblast, the cells that make collagen, suddenly have fuel to do their job properly again. Basically, it tells your skin to start producing more type 1 collagen, where at the same time, blocking the enzymes that break down collagen. So you're essentially training your skin cells to behave younger on an ongoing basis. What's the catch in all of this? So it really takes consistency. One session gives you a subtle glow, maybe some temporary smoothness, but the real change takes weeks to months of regular use. I mean, it's the same thing as going to the gym. So now let's talk laser. Laser is a controlled destruction for rapid renewal. Lasers work on a fundamentally different principle than LED. They create injury to trigger healing. When fractional CO2 laser fires into your skin, it's delivering a focused infrared light with enough power to instantly vaporize water molecules in your skin tissue. So this creates microscopic columns of thermal damage. They surround tissue that stays intact, which is why they're called fractional. But the columns, they're gone. Your body sees this as a wound, and immediately the entire wound healing cascade kicks off. First up, inflammation, white blood cells rush in, then fibroblasts migrate to the area and start laying down fresh collagen. You're making your skin rebuild itself from scratch in those treatment zones. So the results can be pretty dramatic. One treatment can reduce the appearance of deep wrinkles, acne scars, and sun damage, but here's kind of the trade-off. Laser-induced healing means acute inflammation. So you get redness, swelling, sometimes peeling. So you can't do this frequently. Your skin needs time to complete the healing process. There's also the risk of settings that aren't dialed in correctly, too aggressive, and you can get hyperpigmentation, even scarring. This is why lasers need trained clinicians who understand skin physiology and can customize parameters for your specific skin type. So what's actually different? Let me break it down. So LED, non-thermal, it works through photochemical activation of mitochondrial enzymes. So you're getting cell energy and signaling them to produce more structural proteins and less inflammatory garbage. It's cumulative, gentle, and it shifts cellular baseline towards health. And the laser is photothermal. So it works by creating controlled micro injuries that force your skin through accelerated wound healing. So you're leveraging your body's repair machinery to rebuild damaged tissue. It's episodic, intense, and it resets specific problem areas. Strategic integration is to use both intelligently. These are tools that work best together. So think of it this way: LED is your daily maintenance tool. You use your ExoMask 3 to 5 times a week. So you're building a foundation of cellular resistance that slows the aging process. Then once or twice a year, you can bring in a laser for targeted correction. Research shows that LED can actually support laser recovery. For longevity focus, guys, this is the ultimate system. Paired with actives that actually support collagen. So our collagen control facial serum has retinol that work synergistically with LED. The light enhances cellular uptake and amplifies the signaling effects of topicals. For lasers, you're scheduling appointments. You're doing consultations to dial in the right device and settings for your specific skin. You're blocking out recovery time and you're committing to strict sun protection and aftercare.